Hey ho, let's go. My name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Welcome to our public health video blog, and while you best know the ACOI is a place to turn to for quality CME for physicians, both online and in person, the ACOI has also been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns as well. Hence, I offer you this regular public health perspective. Now, just a quick mention that it was great to be together again at the ACOI annual convention and scientific sessions a few weeks ago. It was wonderful to see all of y'all. But if you couldn't attend, it's not too late to register for virtual sessions that are available on demand. But hurry before the CMA cycle ends for the year. All sessions will expire from the ACOI site on December 23rd. So now on for our story of the day. And that is gun violence, and that gun violence is a public health epidemic. So I read a stat that blew me away the other day, and here it is. In 2020, around 23 million guns were purchased. Wow. At the height of a public health disaster where many of us were focused on saving lives, while the country was dealing with COVID-19 in the midst of an economic uncertainty that led to massive job losses and shutdowns, and while the country was reeling from the police violence that resulted in Mr. George Floyd's murder, people went out to buy guns in droves. And there's an organization called Small Arms Analytics that measures gun sales, and not only is that the number that they uncovered, it was so shocking, but also consider that 23 million more guns that were being sold actually represents a 65% increase over 2019 gun sales. And one can only surmise that not only are people buying guns in droves, but there will be more people buying guns, and more people are likely owning multiple weapons. Now, if that doesn't smell like a public health disaster in the making, I don't know what does. Now, not surprisingly, gun violence increased as a result. Over 19,000 people were killed in shootings and firearm-related incidences, according to the Gun Violence Archive, and that's the highest death toll in over 20 years, and a 25% increase in homicides and accidental fatal shootings in 2019. And another fact is that 68% of homicide victims in larger cities are black. So on top of the disproportionate number of black Americans dying from COVID and the police violence widely chronicled against black Americans in 2020, black Americans are also widely suffering from an increase in gun violence. Plus, while suicide rates went down overall in 2020, suicides actually increased in black Americans, which is no surprise since studies have consistently reported that exposure to discrimination and repeated microaggressions is related to increased rates of depression amongst black Americans. Now, also in 2020, the number of mass shootings where 4 or more people were shot and injured or just killed rose to over 600, representing a 50% increase from 2019's total. Time magazine calls 2020 one of the deadliest years in U.S. history between the pandemic and gun violence, and 2021 is shaping up to be the same, if not worse. So how did 2020 end up creating conditions for such record-breaking numbers, and what can those of us in public health do about it? Well, the director of the Johns Hopkins Center for Gun Policy and Research said that 2020 was truly a perfect storm of conditions where everything bad happened at the same time. You had the COVID outbreak, huge economic disruption, and quite frankly, people were just scared. Now, another important point to note is that because kids were not in school, things like after-school programs and other violence disruption programs were not happening. Some also say that with 2020 being a contentious election year, gun purchases went up for the fear that that a new administration would change gun policies and restrict gun ownership. Now, it was also discovered that due to pandemic fears, people had their guns more accessible in their homes and changed how they stored them, keeping them closer within reach. And it's no wonder that the intentional shooting deaths by children, unfortunately and heartbreakingly, rose by nearly a third just last year. Now, the increase in gun purchases is also a bad recipe when it comes to the isolation that COVID brought and the resulting increase in domestic violence. It has also been reported. The domestic violence hotline said that they received the highest incoming volume calls that they've ever received, over 636,000 calls, chats, and texts during the 2020 year. And interestingly to note that nearly 20% of the callers noted that they were experiencing a threat from a firearm. So back to my earlier question, in public health and as internists, what can we do? So one physician who's an infectious diseases physician by the name of Dery, Dr. Gary Slutkin, started an organization called Cure Violence Global. And his belief is that violence should be treated like a disease, one that is contagious and, in fact, genetic. As I mentioned, he's an infectious diseases expert who is the former head of the World Health Organization Intervention Developmental Unit. And he launched his organization in West Garfield Park, which was one of the most violent communities in Chicago. After his organization began working in that community, there was a 67% reduction in shootings in the first year alone. Now, I'm quoting from his organization's website when I say that they believe that violence behaves like a contagious problem. It is transmitted through exposure, acquired through contagious brain mechanisms and social processes, and it can be effectively prevented and treated using health models. And to date, the health sector and health professionals have been highly underutilized for the prevention, treatment, and control of gun violence. Now, with Cure Violence Global, the goal is to help individual communities implement violence prevention programs to significantly reduce violence. So I looked at their approach, and here are their methods and strategies they're using: detecting and interrupting conflicts, identifying and treating high-risk individuals, and changing social norms. Now, I love that Dr. Slutkin is taking action from a unique perspective as a physician, that violence is a public health issue that must be healed. The Cure Violence model is based on the fundamentals of chronic disease management and changing behaviors to focus on detecting and interrupting potential violent conflicts, such as helping to prevent retaliations after a shooting happens, as well as mediating ongoing conflicts. They also work and treat those at the highest risk of committing violence and helping them attain the social services they need. This group uses individuals to engage community leaders to help mobilize the community to change norms, and I think that's brilliant. Now, they're gathering in cities across the U.S., including Atlanta, New York, Philadelphia, D.C., and then in my home city of New Orleans right here. Now, beyond the borders of the U.S., are also working with other countries such as Mexico, Honduras, Brazil, Jamaica, and others. Now, as physicians, and especially as osteopathic physicians that practice principle-centered medicine, we need to practice the principles of practicing deep listening with our patients to keep our eyes and ears open to help spot things like domestic violence, or to recognize patients we suspect that are involved with violent individuals or are stressed and trending toward acts of violence. Knowing our patients are a big part of how we practice medicine as osteopathic internists, and when you view the treatment of violence as trying to rid a public health threat, it is clear that as healthcare providers, we have a role. If you want to know more about Dr. Slotkin's work, you can go to www.cvg.org, that's cvg.org, or search for his awesome TED Talk as well. Stay on the lookout for these updates in the meanwhile, and to read more from the sources using this report, you go to acoi.org/resources. And together with the ACOI, we will help you have the latest information to help you respond to your patients. And as always, feel free to reach out to me at madery@mac.com. And as always, I just need to say thank you to Gina Kilker for another really brilliant script. Everybody, peace out.